A very good evening, everyone. Today we have Vaishali Rai, a theatre and a voice-over artist, an actor and event host. She will be the anchor for this program, asking the right questions to the health experts. Let's welcome Vaishali Rai, anchor Wellness Wednesday.
A very good evening, everyone. Namaste and Mabuhay. Welcome to another episode of Wellness Wednesday by Ivy. Ivy, a not-for-profit organization, provides a platform dedicated to women in enterprise in the Philippines. It aims to empower their entrepreneurial and professional spirit to its highest potential. So for one to achieve their full potential, health is important. The Wellness Wednesday episodes are brought to you as a part of our India-Philippines Friendship Initiative. In our mission of creating health awareness every month, we will bring to you a well-known medical expert with a brand new topic. All you have to do is ask the right question in the comment section, and we will get the experts to answer them. Our previous episodes on COVID-19 lessons and healthy heart were very well received. And for those of you who have missed the session, it is now available on our YouTube channel, the link of which is below. I would also like to request you, our patrons and supporters, to please share and spread these videos on every social medium possible to help spread awareness. You never know, it could save a life. So today we bring to you another topic of relevance, cervical cancer. Cervical cancer is one of the most common cancers amongst women globally. In this episode, Ivy brings to you the awareness to help fight this hidden demon. So join me today for an hour with Dr. Pragya Mishra Choudhary as we speak about what cervical cancer is and is it preventable? Dr. Pragya Mishra Choudhary is a gynecologist from Patna in Bihar, India, specializing in colposcopy and infertility. She has received her postgraduate training in the United Kingdom and has worked as a specialist registrar in Wessex Deanery. She obtained the title of member of the Royal College of Obstetricians and Gynecologists in London and is also a member of the Indian College of Obstetricians and Gynecologists. She has written chapters in several books on the topic, conducted various workshops, and has won several awards in the field. We are so honored to have such a renowned and accomplished guest speaker with us today. Thank you so much for coming here and to speak about cervical cancer and to help us guide our audience today on a topic that is not spoken about much, but yet is a common hidden danger for a woman. Doctor, you have a very impressive resume with many feathers in your cap. Being a PhD in pelviscopy from Germany and a diploma holder in family planning from London, besides having an interest in clinical research, you hold office bearer posts in various societies and associations in India. So Dr. Pragya, do tell us, is it really so that cervical cancer is the fourth common cancer today?
Well, if you look at, especially the underdeveloped countries, with their actually cervical cancer is the most common cancer amongst women. Whereas overall, if you see, well, breast cancer is the most common cancer amongst women, but especially, countries which belong to the Indian subcontinent, like India, Pakistan, Bangladesh, definitely, the cervical cancer is, in fact, it's the most common cancer amongst women.
Okay, so friends, we have with us such an erudite scholar with extensive knowledge on cervical cancer. Let us grab this opportunity to know and understand more from her. We have gathered today's questions from Ivy members and our communities. So for those of you who are watching this live, if you have a question, do send them here on the live chat below. We will try to accommodate as many questions as possible. If we are unable to answer them during the program, we will get back to you later. We are prioritizing the questions that were received earlier. So without further ado, let us begin with our question and answer segment. Dr. Pragya, we have a first question that has come in, and it is, What is cervical cancer? How does it differ from other cancers in the body?
Yeah, then that's a very important question. Well, cervical cancer is actually in lay terms, I would say, it's cancer of the neck of the womb. Okay, like the woman, any woman, she has the uterus, and which and below that, you have the neck or the cervix. Okay, so basically, cervical cancer, if I have to explain it to a woman, I would say it's the cancer of the neck of the womb.
Okay, and
And
what are the causes? Sorry, go ahead.
yeah, no. And I think your second question was that how does it differ from other cancers? I think that's what you asked.
That's right. How does it differ from other cancers
Yeah.
in the body? Yeah.
I mean, how it differs, like, if you see other cancers of women, like, cancer of the uterus or of the ovary, those cancers are actually not that preventable. There are certain factors which can reduce the risk of those cancers, but in reality, those cancers or even cancer of the fallopian tube, they are not preventable. But now, coming to cancer of the cervix, it has been well proven now that it is a cancer which is preventable. And why is it preventable? Because it's the human papilloma virus which has been proven to be the cause of cervical cancer. So that's how, cervical cancer differs from other cancers of women, like, and even for the breast, or, all other different cancers in women. So that way, I think, I mean, if one has to choose, if someone has no choice, then it would be better, if she has a cancer of the cervix than any other cancer, for instance, an endometrial cancer, or a cancer of the ovary or tube or breast.
Well,
That's
that
what
is
I would say.
good news that this cancer is curable, right?
Yes.
So, doctor, what are the causes of cervical cancer?
Yeah. Now, I just said that, well, earlier, people used to associate, associate, or they would say that the risk factors for cervical cancer were like early marriage or early age at first intercourse, multiple sexual partners, and, having too many children, or, coming from the rural background, or poor hygiene. Those were the factors which had been associated with cervical cancer. But now, well, it's research has shown, after extensive research, we know that a human papilloma virus is the cause of cervical cancer. And there are ways, how one would contract it, but the main cause is human papilloma virus. And that is something which is now preventable these days.
Okay. So, there's someone who's asking us that if cervical cancer is hereditary.
No, no, not at all. This is a wrong, I would call it a myth. There are other cancers which can be hereditary, like a cancer of the ovary or of the uterus or even breast or of the bowel. But no, because carcinoma cervix is not hereditary. So that is something which, women have to take this out of their minds, that it's not a cancer which is genetically related, or it's hereditary in origin.
Okay. So, ladies out there, cervical cancer is not hereditary, so you don't have to worry about that. And, doctor, how does one get infected with this virus that you just mentioned, papilloma?
Yeah. So basically, well, human papilloma virus is, uh, is how it's actually spread through sexual intercourse, which is the most common cause of human papilloma virus infection. But but not only through sexual intercourse, it can also spread through a non-sexual skin-to-skin contact of the genital area. Okay, so it's so one would sometimes think that it's only that, if someone is not sexually active, whether she can still get human papillomavirus. Well, she can still get human papillomavirus because of this skin to skin genital contact. So,
Right.
yeah.
So very interesting. So one can still get it, even not by sexual intercourse, but just by the skin rubbing against each other if one person is infected.
Yes.
And how can we prevent this? How can we prevent this from getting, or how can we prevent from getting infected?
Okay. Now, one more thing. I would like to tell you that, a woman in her lifetime, she is at some point, they are all, they harbor human papilloma virus. But the ones who actually end up having precancerous or cancerous lesions of the cervix are the ones, where the human papilloma virus actually persists in the cervical epithelium. It doesn't normally you would expect it to clear, by 2 years or so maximum. But then if it persists, then those are the women who are more inclined or prone to get precancerous or cancerous lesions of the cervix. And now you know how we can prevent it, as you know that there is a vaccine which is very effective against human papilloma virus. And there are, well, and it contains a few strains of the virus which are effective against the strains which most commonly lead to cervical cancer. And worldwide, the two vaccines which are available are the Cervarix and the Gardasil. And these are the two vaccines which are available worldwide. And these vaccines now, which some people are not aware, the earlier you give, to a woman or to a girl, the more potent it is. So these days, we have started actually in administering these vaccines to girls who are from the age of 9 years of age. So, most of the times, it's not the gynecologist who keeps the vaccines with her or him. It's the pediatricians. Now, the pediatricians are administering the vaccines because guidelines have come that, you can give it from the age of 9 years. And if you give between the age of 9 to 14 years, then if you just give 2 doses of the vaccine, that is actually suffice. Because normally, within a period of 6 months, we have to administer 3 doses, like one vaccine which is Cervarix. It is administered at 0, 1, and 6 months, and Gardasil is administered at 0, 2, and 6 months. But now after this, if you administer someone below before the age of 14, the benefit is that even 2 doses are enough. And recently, some latest data has come from WHO, which says that even one single dose of the vaccine can be potent or effective against cervical cancer. This is something latest which has come, from WHO. But I mean, that vaccine is not available to us. The ones which are available to most of us worldwide is the one which has 3 doses in 6 months, or of the same vaccine which you can give 2 doses to younger girls, between 9 and 14. But very soon, I think we are going to get the vaccine which even one dose would actually be enough for somebody to prevent herself from getting cervical cancer.
This is really wonderful news, Dr. Pragya. It is so nice to know that um, it is curable and preventable, and these vaccines are helping. We have certain questions that have come in regarding this vaccine. So, does this vaccine have additional advantages?
Yes, the advantages are that, with the quadrivalent vaccine, is that it can prevent benign warts, like warts. People could get warts in the genital area, so it can also prevent somebody from getting genital warts. That's one big advantage, because warts are a very painful condition, if you know. And secondly, even other cancers, like in men. or other cancers of the anogenital region, like anal cancers, which are also related to human papilloma virus. Yeah.
Right.
Even for instance, for like in some countries, they've started, I think in Australia, that's where they administer the vaccine. They've started giving it to the boys as well, because so that it can prevent penile cancers or other anogenital cancers. So those are some other advantages of this HPV vaccine, apart from prevention of cervical cancer.
That is so good to know, doctor, that
Yeah.
this vaccine has additional advantages as well, and not just targeting cervical cancer. We have someone here who has just asked us, what if a person falls pregnant after the first dose of the vaccine?
Yeah. One thing I would like to tell you that this is a very common question, because it could happen that the woman has had one vaccine and after that she falls pregnant. So what does she do? Whether she should go for the second or the third doses. So ideally, no, it would be better that she goes for the remainder of the doses of the vaccine after she delivers. The reason being is that because specific studies have not been carried out in pregnancy, or I would say not enough research has been done with the vaccines, administering the vaccines during pregnancy, that one would know whether it can be harmful or not. So it would rather be advisable that she goes for the remainder of the doses after her delivery.
Okay. So, ladies out there, if you have taken your first dose of vaccine, and if you have fallen and if you have gotten pregnant, do take the rest of the doses after your delivery. It is much safer then. Dr. Pragya, what if a person has taken the vaccine and is unaware that she is pregnant?
Yes. Again, well, inadvertent use of the vaccine, well, that doesn't mean that, she should undergo a termination of pregnancy if she gets to know. Because it can happen, that she's taken the first dose, and soon after that, she realizes that, she has missed a period, she's pregnant. But it doesn't mean that, I mean, she can carry on with the pregnancy. But I would advise that, she doesn't go for her second or the third dose. Okay. But you definitely shouldn't go for termination of pregnancy. That's one thing which I really want to highlight, because it has happened in the past with other vaccines also, like rubella, etc. And where now, well, it's well proven that inadvertently, if someone has taken one of these vaccines, she should not undergo a termination just for the sake of that.
Oh, that is again very good news that one need not undergo termination of pregnancy, which is very nice. We have a question that has come in, doctor, that what are the risk factors of cervical cancer?
Yes, actually, at the beginning of of our conversation, I did say that the risk factors are having having intercourse at a very young age, and having multiple sexual partners, and having too many pregnancies, and like poor the hygiene of the genital area. So those kind of reasons, I mean, they are, I actually would say that these are associations, because these all speeden up the infection with human papilloma virus. So the main cause is the human papilloma virus, which is the one cause of cervical cancer. And
Right.
all these factors, they just facilitate the progress of of the human papilloma virus.
Okay. So does the use of genital wash help reduce the risk of contracting this virus?
That's something interesting, which I mean, it's good. It's come to your mind. Um, Genital wash. I mean, well, basically that would help with good hygiene of the perineal area of the genital area. So keeping oneself clean or being more hygienic, definitely I think that could prevent the spread of human papilloma virus, thereby leading to prevention of cervical cancer. So because poor hygiene has been associated with the with the spread of cervical
Cervical
cancer.
cancer.
Yeah.
Okay, we do have lots of questions coming in, and the next one is, how would a lady know that she has cervical cancer? What are the signs and symptoms that she must look out for?
Now, see, cervical cancer is, I mean, the good thing about cervical cancer is that it's something which, has a long precancerous stage. One goes through these stages like of cervical, the precancerous stage, which is cervical intraepithelial neoplasia that we call, that itself, goes from CIN 1 to 2 and 3. So before one actually ends up having cervical cancer. Whereas, with other cancers, there's no way that, we can screen earlier. And for instance, cancer of the ovary, still there is no such tool which would definitely through which you can screen for CA ovary or CA uterus. But
Mm.
at least for cervical cancer, is something which through regular screening, you would know that. So the best way is, how a woman would get is, if she is undergoing regular screening, and that's how one detects some abnormal cells in the pap smear. So that is the most important way, that rather me telling you that what are the signs and symptoms, because it is one cancer which you can actually screen or catch in a precancerous stage is through screening. And when you screen through a pap smear, or what happens that you look for abnormal cells in the smear, and that's how we know that this woman is at a risk, and then we call her for further treatment, or for further screening, etc. But otherwise, I would generally speaking, I could say that if someone has persistent vaginal discharge, because some women, for instance, in a country like India, although we keep teaching and telling that go for cervical screening, but still it's the problem with the problem is that we still don't have an organized, structured screening program like you have in UK or USA, and perhaps even in Philippines. So here we still don't have an organized, structured screening program. So what happens that mostly screening is also done, you can call it an opportunistic screening, when a woman comes to the gynecologist with some symptom like persistent vaginal discharge, or she has some bleeding at bleeding after intercourse, or she has intermenstrual bleeding, which is bleeding in between two periods, or she has foul smelling vaginal discharge. I mean, those are the symptoms which I can say, at least even if a woman who's not gone for screening, at least if she has any of these symptoms, she must see a gynecologist, get herself screened for cervical cancer, which would mean either going for pap smear, or where feasible, available, affordable, then she should go for HPV DNA testing, which is even like it's a more sensitive way of screening for cervical cancer, more sensitive than a pap smear.
Right. And doctor, how frequently should one do this screening?
Yes. Now, now from the age of depends. In some countries the cutoff age is 25, and in some countries it's 30 years. So one should start screening at every 3 yearly interval, from the age of 25 or 30 up to the age of 65 years. And after that, the screening interval can be lengthened, from 3 years to 5 years, because it has been seen that the incidence of cervical cancer after the age of 60 or 65 goes down. So it's the target population is the population in the younger age group, which would mean 25, 30 to about 55, 60 years of age. And in countries where, they are using HPV DNA testing as the primary mode of screening, then, the screening interval has been lengthened. Instead of 3 years, one could go for screening for every 5 years. If in your country, if HPV DNA testing is used as the primary method of screening. So that's the advantage of HPV DNA testing. But since, like I practice in India, and I know HPV DNA testing is still quite expensive. So not many women, are able to afford it. So usually, we start with the pap smear, which could be which could be either which is either done in the conventional through the conventional method, or through liquid-based cytology, which is better and a modern way of pap smear testing. And if we find any abnormalities, then we send you refer the patient for colposcopy, and that's how. And then there are ways like either you can just see and treat at the same time, or you can screen and treat at a later date. So that depends.
Okay, so all you ladies out there, don't forget to go for your screening regularly. It is very important. And I would suggest to all the corporate leaders watching this episode, we would like to make a humble request to organize free cervical screening for camps for your women staff.
Yes, that's a very good thought, and that's what we've been doing. Holding camps from time to time in suburban and rural areas, because the urban women, they are quite accessible to the health structure and the facilities, and it's the women in the suburban areas or in the peripheral areas who don't get the opportunity to like you get themselves screened even once in a lifetime. And what they say that if a woman gets screened even once in a lifetime, or if she gets a colposcopy done once in a lifetime, you can reduce the incidence of cervical cancer by 65%. So that's actually, you would say, a boon indeed. So it's something, which, and that's how, so it makes cervical cancer different from other cancers of women.
Okay. So, doctor, should one continue with screening after vaccination? Because people have the notion that if vaccinated, then screening is not required.
Yes, so, I mean, that's a very good question and a very important question as well, because a lot of women, they think, oh, I've had the vaccine, and it means that, she doesn't need to get herself screened later on in life. But that's actually a wrong notion, because, it's not like, an oral polio vaccine that, you've got it, and, and you're protected for the rest of your life. And the reason is because, there are several strains of human papilloma virus, which can lead to cervical cancer. And, the vaccines which are available, they don't, they are actually protective against the common strains, or 16, 18, 31, 33, which are the most common causes of cervical cancer. But there are other strains also which can lead to cervical cancer. So that's the reason, in spite of having the vaccine, a woman still needs to get herself screened later on, even after the vaccine. But
Okay.
the good advantage is that, if we start vaccinating young girls, then perhaps, time may tell us that, if vaccinating girls between the age of 9 to 14 years, mm, I mean, before starting their sexual debut, that can actually perhaps, I don't know, time may tell that screening may not be required, but I don't know the answer to that at present. So for now, I would say, well, screening is important,
Right. So, thank you for
even
that.
after you had the vaccine.
So, we have a mother sending us a question over here. You already actually answered it, but the question is vaccinating prior to puberty of a girl, is that okay? Because the child would still be following the booster shot schedule till the age of 10. So is that still okay?
Well, I wouldn't call it a booster because, see, I mean, we have like 9 to 14, you just give 2 shots of the vaccine. Or recently, as I said, WHO has come up with, there's a study where they say that in that age group, even 1 shot could be useful. So boosters means, giving boosters later on in life. So still, we don't know for now. We've not been giving boosters for cervical cancer vaccine.
Okay.
So
So,
basically, you give the primary vaccine, which is either 2 doses or 3 doses.
okay.
Boosters are still not, because, well, we don't have boosters available for now. And so we don't know the answer whether, we have to give boosters to them.
Okay. So I would say that everyone out there, you have to educate your friends, your family, your mother, your sister, your daughter, that vaccination is important, and also a regular screening is important, and definitely that can save you from cervical cancer, especially now that cervical cancer is curable. So, other than pap smear, doctor, what additional tests are required to diagnose cervical cancer?
Well, this HPV DNA testing, human papillomavirus DNA testing through hybrid capture technique. That's again, the test is done, it's more or less in a similar way, just like you do a pap smear. It's also done with a brush and, you just, so the technique is the same with HPV DNA testing. So if someone can afford it very well, I would definitely offer her the HPV DNA testing. But and let me tell you that in some countries they use, like in a lot of European countries, even colposcopy is used as a screening tool for cervical cancer. Although, like in countries like UK and USA, they would only refer somebody for colposcopy if they find something abnormal in a pap smear or on HPV DNA testing. Only then they would refer a woman for colposcopy. But like in some of the European countries, like colposcopy is being used as a screening tool also. So when you go, I mean, if you find something abnormal on colposcopy, you can actually take a biopsy there and then, or you can treat the patient there and then, which is just see and treat. And but this I'm talking about precancerous lesions. I'm not talking about cancer cervix. In the,
Okay.
yeah, so that would, so what we try to catch women when they are in a precancerous stage. So all this screening tools and colposcopy are mainly for that. So it's not for you
So,
can detect cervical cancer through it, but the screening means that basically catching them before she
at
has
an early stage,
yeah,
basically.
microinvasive or invasive cancer.
Okay. So, once somebody catches the cancer and it is curable after she catches the cancer, right?
Yes, depends on what stage she is. I mean, well, like there are ways of treatment, and that would depend on whether it could be surgery or it could be chemoradiation. But that all depends on what stage is she on. Well, if it's early stages, then even it's when it's just called microinvasive, very early stages, then we can even treat through local methods, those are on very early stages. But if it's more advanced, then you go for more advanced surgery, which would mean removing the uterus, the cervix, and the tissues on the sides of these structures and the lymph nodes, which which is I don't want to use medical terms because I know it's for lay women. So then you go for a slightly advanced surgery. Then, of course, if it's spread more beyond that, when we call it stage 2B onwards, then, that's the time when it's too late for surgery, and then you go for chemotherapy or a radiotherapy. So that depends, what stage. And obviously, early stages, the prognosis is good, and it has a very good 5-year survival rate. Whereas, the later, it's detected, the later it's treated, like for any other cancer, obviously the survival rate would go down. And
Okay, doctor, thank you so much. We are almost towards the end of our program. Is there anything that you would like to tell our audience from your end as a doctor?
yeah, I would just tell you that when you go to when you go to the gynecologist, and if you have a daughter who's young, so always inquire about the HPV vaccine, especially if you have daughters who are, in that age group, who are above 9 years, and they are not sexually active. That's the best time to administer the vaccine, because the immunogenic potential of the vaccine is very good at a younger age. So if you not that well, the companies which are making the vaccines, they would even say that you can administer the vaccine up to the age of 40, 45 years. But the but the later on in age that one gets the vaccine, the less the immunogenic potential of the vaccine. So normally, I always use this, I would call it a slogan, that vaccinate your daughters. So vaccination for the daughters and screening for the mothers. Because mothers, who are above, like say 35, 40, definitely go for screening, because, the vaccine may not be that effective for you. So you can just remember this: vaccination for your daughters and screening for the mothers.
I
And
love
then by practicing these two, or through this dictum, I think we can go a long way in prevention of cervical cancer. And as you know that, still, I mean, while I'm talking to you, during this, last 40, 45 minutes, I think so, so many women all over the world would have died of cervical cancer. So it's something, it's something preventable, and that's how it has an edge over other cancers. That's the good part, and it's something which really can be prevented. And government should focus, any government of any country should actually allot resources and fund on upon screening of cervical cancer, because it's something which, it's a real tragedy, because most of the women who lose their lives out of cervical cancers are in the prime of their life. It's usually around 40 years or so. And it's really sad, because so much of unfinished tasks or work, and she just leaves her family in so much of, it's a real tragic thing, well, children have not finished their education, children have not, children are not settled by then, and she herself has so many unfinished tasks, and that's how she just leaves the family and goes away. So,
And especially it's worse when you know that it is preventable and it is curable, right?
yes,
So we can definitely save a life over there by just educating people. Go for your screening and go for your vaccination. We cannot emphasize more on that. So that brings us to the end of today's question and answers segment. Dr. Pragya, I am feeling so positive today after this session that it really shows, this session actually really gives me hope that one can survive this and one can prevent this. And I hope that we have been able to educate our women on this topic. And today's session has definitely enlightened us on a very important issue on women's health. And the best part of it is that it is curable if diagnosed early. We have 3 takeaways, and cervical cancer is preventable if you get vaccinated at the right age. Regular screening for cancer can help with early detection. HPV, DNA, or Pap smear tests can help with early detection. Remember, vaccination for your daughters and screening for your mothers.
Yeah, I would just clap to that.
And to the corporate leaders out there, we would really request you to think about this and have a screening done for your women employees regularly. That would really help. Okay, friends, I hope this session was as educating and helpful to you as it was for me. So that was Dr. Pragya educating us on prevention of cervical cancer. So if you or your loved ones or anyone around you shows those signs and symptoms, don't hesitate to go see your gynecologist immediately and keep doing your screening regularly. Since this is a very relevant topic with regards to women's health, not too many people are aware of the right information. Let us take it up on us to educate them and spread awareness on cervical cancer. Who knows that we could even save a life because of that? Do share this video of awareness and help us spread the word globally. Together, we can help fight this cancer. The next episode coming up is on ergonomic posture and the prevention and treatment tips on backache and neck pain in this gadget era. Do mark your calendars and don't forget to tune in on the 6th of July for the next episode of Ivy's Wellness Wednesday with Dr. Gira Clerk. Watch this space for more details, and you can send in your questions on the topic right here on this page. Do keep asking your questions and we will get the answers for you. Until then, take care, stay healthy, stay safe, and stay well. And most importantly, educate and spread awareness. Because a better I is a better we. This is me, Vaish, your host for Wellness Wednesday, signing off. Good night and namaste.